Welcome to the Springfield College Guest Lecture Orientation video and slides. First of all, thank you. Thank you for your time. Thank you for your expertise. Having someone working in the field coming in to lecture our students is invaluable to their education, and the students genuinely appreciate your guest lecturing. When you're guest lecturing is part of the clinical medicine series. Clinical medicine is part of the didactic year, or that first year of the professional phase of the PA program. Other courses that are going on at the same time as clinical medicine include clinical anatomy, pharmacology, and history and physical exams. Clinical medicine is designed to be the course that is the most rigorous and test students on their medical knowledge and competence to move forward in the program. The clinical medicine series takes place over 3 semesters, starting in the summer, then fall and spring. Taking a look at this schedule will give you a better idea of where students are at when you come into lecture. For example, if you're doing a pulmonology lecture in the summer, students have only had 3 other blocks before you: dermatology, ENT, and ophthalmology. Because of this, they may be less familiar with certain lab values, certain radiology, or certain terms because they just haven't been exposed to as much. Opposed to that is in the spring semester, when if you're coming in to do a orthopedics lecture, the students have had a large variety of medicine, including clinical diagnostics, before you come in. So you may be able to spend less time on the basics, and the student should be at a higher level of learning at that point. The way that this slide is structured shows the actual time frame in which the different blocks are aligned. So for example, the students come in, their first block is dermatology, ENT, and immunology. They do that for about 3 to 4 weeks. Then they have an exam on those topics. Then they move on to ophthalmology and pulmonology, so on and so forth. The required text for the clinical medicine series is current medical diagnosis and treatment, whatever the up-to-date year is for the time that you're teaching. I use current as a reference for creating exam questions, and sometimes when things in medicine get gray and they may be getting some conflicting sources, current kind of serves as the baseline foundation for students. In terms of assessment, students get a 50-question examination based on the current block. So going back to previous, the first block is dermatology and ENT. At the end of that block, they have 50 questions on dermatology and 50 questions on ENT. Each question follows one of these types of formats. This is based on the PANCE, which is the PA boards, in preparation for preparing them for the PANCE. Applying basic scientific concepts, history and physical exam, formulating most likely diagnosis, diagnostics, clinical intervention, pharmaceuticals, patient education, prevention, and health maintenance. Each lecture should touch on each one of these things: the basic pathophysiology, how patients present, what you're going to find on history and physical exam, including risk factors, how to make the diagnosis, what are the appropriate diagnostics, how do we intervene, when do we intervene, what pharmaceuticals would we use in which situations, and how do we educate our patients, and is there any prevention or health maintenance? If there's an associated vaccination, screening, such as low-dose CTs for lung cancer, those should be included in your lecture. Here is a sample question that we would use on a typical clin med exam. As you can see, it's based in a clinical format. This is very similar to the PA boards. In this question, the student needs to work through the patient information and has to know the most likely diagnosis in order to answer the question: what organism is most likely responsible for the patient's condition, which would be applying basic scientific concepts. These are higher level questions because if the student can't formulate the most likely diagnosis, they're going to obviously have more trouble with understanding what condition or what organism is causing it. But this is the level of questions that PA students in the professional phase are expected to be able to answer at the end of each clinical medicine block. So how should you structure your lecture? Lectures are, by and large, taught in a slide format. Most students would prefer that they have the slides available before the lecture so they can look them over and have them in front of them during the lecture. If you don't want students to have your slides ahead of time, that's perfectly fine too. If you'd like the students to have them, please email them to me. 24 hours is ideal, but I try to get them up onto our platform as soon as I receive them. And here's my email. A list of lecture objectives at the start of your lecture is strongly encouraged, and I'll give you an example of those in the next slide. Students should have a 5 to 10 minute break after every 50 minutes of lecture, and students are expected to master the material at the level of a PA working in internal medicine. So particularly if you work in a specialty, at this phase, we do not expect students to be proficient as a specialist, as opposed to being proficient in general internal medicine, knowing that they may refer to a specialist. For example, working in surgery, we do not test them on surgical technique, but we would test them on signs and symptoms of surgical conditions, complications of surgical conditions that someone might be following up with, things to look out for, risk factors, prevention, things like that. Here is a sample of lecture objectives. That way the student understands what they are expected to get out of your lecture. We also provide standardized objectives for the students for each block. And I am happy to provide the lecture topics or the objectives that apply to your topic ahead of time. Feel free to ask. We encourage everyone to promote an active classroom. Students are in clinical medicine from 8 a.m. to 4 p.m. 4 days a week. Fridays are our lab days. So sometimes, especially if you're coming in right before lunch or later in the afternoon, students fatigue very easily if they're just talked to all day. To promote an active classroom, I encourage you to include pictures in your slides. I also use pictures on exams to replace descriptions at times. For example, if I'm testing someone on varicella, instead of describing the rash, I may include a picture of the rash and expect them to be able to discern what that is. Cases and practice questions are also highly encouraged. Students love to then apply their information to a case. A patient that you've seen, working them through a case, whenever they can apply that to actual practice, they tend to be much more engaged. And you can ask questions throughout your lecture. Some people do a pre-test and a post-test, but something to encourage the students to remain engaged throughout your lecture. Our goal is for students to not just memorize facts and take an exam, but to be able to critically think about a condition and apply that to medical practice. At the end of each block, students will provide guest lecturer evaluations. I give the students a survey for each guest lecturer that lectured in that block after the exam and ask them these questions. Were the objectives of the lecture clearly defined? Did the lecture present in a clear, concise, and organized manner? Did the lecturer use examples or illustrations to clarify the material presented? Did the lecturer use questions, cases, or other materials to encourage engagement? Did the lecturer increase my knowledge of the topic? And I also allow the students to leave comments if they would like. Once I get the survey information, I will email you your individualized feedback, usually within a week after the block ends. Also a note about payment. Payments goes out at the end of each block. So if you're lecturing in the beginning of the block, most blocks are 3 to 4 weeks in length, and payments will go out after that. Please do not hesitate to reach out. I am the coordinator of this course. My name is Lonnie. And I am also lecturing. I do the pathophysiology lectures for each block as well. I'm happy to talk about something that you're noticing is not being covered, or going over what is exactly asked on an exam so that you're familiar with the level in which we're expecting students to understand the material. Or if you would like any help structuring your lecture, I'm always available. Again, here's my email, and there's the number to the PA office as needed. Again, thank you so much for your time and your willingness to contribute to PA education. It is really invaluable, and I very much appreciate it. Have a great day.